I'd like to begin with the fascinating story of the X-ray. In 1895, Wilhelm Conrad Roentgen discovered this powerful form of electromagnetic radiation. What makes X-ray unique is their high energy, short wavelength, and ability to penetrate opaque materials. From the moment of their discovery, X-rays transformed medicine and science, opening a window into the human body and the material world. They remain one of the most important tools in diagnostic and research, bridging physics with healthcare. Scientific instrumentation plays a vital role across multiple fields. In medicine, imaging techniques such as radiography, CT scan, mammography, and fluoroscopy allows doctors to diagnose and treat with precision. In industry, non-destructive testing ensures the safety of aerospace design and construction projects without damaging materials. In material science, X-ray diffraction and spectroscopy helps us analyze crystal structures at the atomic level. Even in forensic and art studies, these tools uncover pigments in ancient artworks, detect corrosion, and analyze forensic samples. Clearly, instrumentation is not just about machines, it's about unlocking knowledge across disciplines. While X-ray and imaging technologies are powerful, safety must always come first. The guiding principle is ALARA, as low as reasonably achievable, which remind us to minimize exposure whenever possible. Personal protective equipment such as lead aprons and shields must be worn consistently. Dosimetry and monitoring ensure radiation levels remain safe for staff. Equipment is designed with safety features, but extra precautions are essential for pregnant patients and healthcare workers. Finally, proper training and strict protocols safeguard both professionals and patients. By respecting this safety measure, we harness the benefit of imaging while protecting health.
Now, I will explain the technology and applications of X-rays. X-rays are a type of high-energy electromagnetic radiation that can pass through many materials. They are produced inside an X-ray tube when high-speed electrons collide with a metal target. Since different materials absorb X-ray differently, image can be generated to reveal internal structures. Modern X-ray systems use digital detectors to capture and process images quickly and accurately, making them highly useful in various fields. An X-ray system consists of several important components, including the X-ray tube, high-voltage power supply, detector, and computer processing system. X-ray technology has many practical applications. In medicine, X-rays are commonly used to diagnose bone fracture, detect lung diseases, perform dental examination, and create CT scan images that help doctors make an accurate diagnosis. In industry, X-rays are used for non-destructive testing, which allows engineers to inspect the internal structure of materials without causing any damage. This method is widely used in pipelines, aircraft maintenance, and manufacturing quality control. In security systems, X-ray scanners are commonly used at airports and cargo checkpoints to detect prohibited or dangerous items quickly and efficiently. Modern X-ray technology continues to advance through digitalization and artificial intelligence. Digital radiography provides faster image and better image quality compared to traditional film-based systems. Artificial intelligence is increasingly being used to assist healthcare professionals in detecting abnormalities and improving diagnostic accuracy. Portable X-ray devices have also improved healthcare accessibility, especially in emergency situations in remote areas. Furthermore, low radiation imaging technologies help reduce patient exposure while maintaining high-quality imaging results.
There are 4 benefits for X-ray machine. First, it will give us a quick diagnosis. X-ray image can be produced within a minute. It helps doctor quickly identify the fractures, infection, and other medical conditions, especially during emergency. Second, it have a non-invasive procedure. No surgery or insertion of instrument into the body is required. Patient experience minimal discomfort during the examination. Third, relatively low cost. X-ray examinations are generally more affordable than advanced imaging methods such as MRI or CT scan. This makes X-ray technology widely accessible in hospital and clinic. Lastly, it's help monitor treatment progress. Doctor can use repeated X-ray to observe how bones heal after refraction. It also useful for monitoring and progression of a certain disease and evaluating treatment of effectiveness. There are 4 points for the challenges. First, exposure to the ionizing radiation. It can damage our body cell. Second, if we use it excessively, it will be risk to our health. Third, for the limited soft tissue visualization, X-ray provide a clear image of bones but are less effective for viewing soft tissues such as muscle, ligament, and the brain. Lastly, it requires a trained personnel to handle X-ray. A skilled radiographer are needed to operate the equipment safely and correctly. Radiologists are required to accurately interpret the image and provide the diagnosis. X-ray or message offer a fast, affordable, and effective diagnosis imaging, but carefully use is necessary to minimize the radiation risk and ensure the accurate result. That's all from me. I will pass to the next member. Thank you.
Next, we move to the future development and innovation that we can do in X-ray. First, improve the resolution and image quality. This improvement is good to get accurate diagnosis and treatment planning. Advancement in X-ray detectors, such as the development of photon counting detectors, are set to provide higher definition image, so we can get more clear image. Next, reduce radiation exposure. Minimizing radiation exposure remains a critical focus in X-ray development. X-ray phase contrast imaging is another promising development. This can provide more detailed image at much lower radiation doses, and this can make it more safer for patients. Third, multi-contrast and phase contrast X-ray imaging. Traditional radiography relies on attenuation contrast, the degree to which tissues absorb or scatter X-ray. This form of contrast is useful to detect the large abnormalities and fractures. However, it has limitations when dealing with soft tissues. New imaging approaches are being developed to expand the information available from X-ray beams. For example, phase contrast imaging detects changes in the base of X-ray as they pass through tissue. And the last one is portable and wireless X-ray systems. Future portable X-ray device will become more compact, lighter, and easier to use in emergency departments, disaster zones, and home healthcare service. By doing this too, we can provide more faster service.
Thank you to my team members for their detailed insight. For this final section, I will take over to present, where I will synthesize our key finding and deliver the ultimate conclusion of our PH1 280 project on X-ray instrumentation. Our first and most vital conclusion focuses on fundamental principle of X-ray imaging. As a core concept in physics, the entire visualization process relies strictly on differential photon attenuation. This phenomenon occurs because different tissues and materials possess distinct densities and atomic numbers, otherwise known as the Z numbers.
high-density structure with high Z numbers, such as bond or metallic object, absorb a larger fraction of the incoming X-ray photons. On the flip side, low-density soft tissue allow the photon to pass through much more easily. It is precisely this variation in photon absorption that generates the real-length image contrast required for accurate clinical and diagnostic evaluation. Moving on to our second point, which details the core utility of X-ray. Through our comprehensive study, our group want to highlight that X-ray technology can extend far beyond routine hospital check-ups. It serves as a foundational pillar in heavy industry through advanced non-destructive testing or NDT and structural characterization. By applying NDT method, engineers in fields like aerospace and manufacturing can evaluate the internal integrity of critical aircraft components, pipelines, or concrete barriers without inflicting any structural damage. This perfectly highlights how fundamental physics bridge the gap into real-world industrial problem solving. Okay, next, we absolutely cannot overlook the operational risks associated with this technology because X-ray utilize high-energy ionizing radiation. Managing safety is an absolute priority. To mitigate this radiation hazard, strict compliance with radiation protection framework is mandatory through the ALARA protocol, which stands for keeping exposure as low as reasonably achievable. This requires operators to minimize exposure time, maximize their distance from the source, and utilize proper structural shielding such as lead aprons to safeguard both the medical staff and the patient. Finally, let's look at the future horizon of X-ray instrumentation. This technology is far from static. It is rapidly transforming through artificial intelligence integration. By utilizing AI algorithms, automate defect and tumor detection is become incredibly precise. When combined with next-generation 3D compute tomography, we are looking at an era of unprecedented three-dimensional visualization that delivers higher spatial resolution while simultaneously lowering radiation doses for patients. In conclusion, the next slide represents the academic reference that our team compiled to ground this research in verified scientific literature. So let's conclude our presentation on PHY 380. Thank you so much to Dr. Azina for your time, guidance, and your attention.
I just had to let you know you're